Why intoxication topics matters today. In today's world where stress levels are at an all-time high and distractions are everywhere, many people turn to substances like alcohol, soda, prescription drugs, or even excessive water consumption for relief, escape, or performance boosts. However, these habits, when left unchecked, can lead to a dangerous stress known as intoxication. Intoxication is not limited to just alcohol or illegal drugs. It encompasses any substance that, when consumed in excess, impair the normal functioning of the mind or body. The danger of intoxications go beyond the individual and often extend to families, communities, and entire societies. Understanding the adverse effect of intoxications and learning how to prevent or reverse them can save lives, protect mental health, and restore families. This video dives deep into the physiological, psychological, and social effect of intoxications, supported by research, expert opinion, and real life experiences. Now, what is intoxications? Intoxication refers to the condition of having physical or mental control impaired by the effect of alcohol, drugs, or other substances. It can be temporary in short term or develop into a chronic conditions, long-term addictions. Now, types of intoxications. Alcohol intoxications, drug intoxications, including prescription drugs like Oxycodone or lithium, caffeine and sugar intoxications from soda or energy drink, water intoxications, hyponatremia due to overhydration. Each form of intoxications affect the body differently, but often share common symptoms like confusion, lack of coordination, memory issues, or even coma and death in extreme cases. First one is alcohol intoxications, the global epidemic. Alcohol is the most commonly abused legal substance. According to the World Health Organization (WHO), harmful use of alcohol results in 3 million deaths annually worldwide. Short-term effects of alcohol on the brain: loss of judgment, impaired motor coordination, speech slurring, emotional instability, memory blackout. Long-term effect of alcohol on the brain: shrinkage of brain tissues, impaired memory and learning, increased risk of neurological disorders like Wernicke-Korsakoff syndrome, risk of depressions, anxiety, and cognitive decline. The adverse effect of alcohol extend beyond the brain. It interferes with nearly every bodily system. Now, number 2, effects of alcohol on the body. Liver, fatty liver, steatosis, alcoholic hepatitis, cirrhosis, irreversible liver damage. Now on heart, high blood pressure, cardiomyopathy, weakened heart muscle, irregular heart rhythm known as arrhythmia. Now on digestive system, gastric ulcer, esophagus damage, vomiting and acid reflux. Now, next is reproductive system, reduce testosterone and fertility, hormonal imbalances. Now on skin and immune system, poor wound healing, frequent infections, premature aging. Now, number 3, hangover effect on the body. Hangovers are often trivial, but they signify a deep disturbance in body functions. Dehydration, electrolyte imbalance, gastrointestinal irritations, fatigue and weakness, cognitive fog and anxiety. Hangover effect on the body reduce productivity and increase the likelihood of accident and emotional distress. Number 4, mechanism of addiction. Why it is hard to quit. The mechanism of addiction involves the brain's reward system, primarily governed by dopamine, a feel-good neurotransmitter. Here is how addiction builds. Number 1, a substance causes a spike in dopamine. Number 2, the brain remembers the pleasurable feeling. Number 3, continued use decreases sensitivity, requiring more of the substance. Number 4, withdrawal symptoms appear when the substance is absent. Number 5, the cycle of dependency begins. This mechanism applied to alcohol, nicotine, opioids, caffeine, and even sugar. Now, number 5, side effects of medications, lithium and oxycodone. Lithium, commonly used to treat bipolar disorder. Side effects include hand tremors, weight gain, kidney dysfunction, thyroid disorders, confusion and speech problem in high doses. Oxycodone, a strong opioid for severe pain. Side effects includes drowsiness, constipations, respiratory depressions, dependence and overdose, long-term brain function impairment. Both medications should only be used under strict medical supervision due to their narrow therapeutic window. Number 6, effects of soda and sugar overload. High sugar consumption, especially from soda, has severe long-term consequences. Insulin resistance, increased fat storage and obesity, type 2 diabetes, liver damage, non-alcoholic fatty liver disease, dental decay, behavioral issues in children. Excessive soda intake mimics the mechanism of addiction, causing regular craving and mood swings. Number 7. Water intoxications explained. Water intoxications or hyponatremia occurs when the balance of electrolytes in your body is disrupted by excessive water consumption. Symptoms include headache, nausea and vomiting, seizures, swelling of the brain, coma and death. Athletes and detox enthusiasts are at higher risk. The key is moderation. Number 8. Alcohol addiction and how it affects the family. Alcohol addiction does not only harm the user, it devastates family. Emotional neglect of children, increased domestic violence, financial instability, divorce and separations, anxiety and depressions among family members. Children raised in such environments may grow up with trust issues, low self-esteem, and substance abuse problems of their own. Number 9. Social and mental decline. Prolonged intoxication leads to loss of job and income, academic failure, legal problem, for example DUI, depression and suicidal thoughts, social isolation. Mental health deteriorates with continued use, leading to a vicious cycle of dependence. Number 10. Prevention and recovery. Taking back control. What you can do. Limit alcohol consumption to recommended level. Switch soda with herbal teas or fruit infused water. Be medication smart, follow your doctor's advice strictly. Educate youth about the risk of substance abuse. Seek help early. Counseling, rehab, or support groups like Alcoholics Anonymous. Healing is possible. The brain has neuroplasticity, meaning it can form new pathways with consistent effort and support. Recovery is not only possible, but it is life-changing. Now the real life story. Meet Mr. John. John, a 42 years old software engineer, began drinking every evening to cope with stress. One drink turned into 5. He lost focus at work, was diagnosed with liver damage, and his wife left him. But after joining a recovery program, and getting therapy. John is now sober for 3 years, reunited with his family and mentoring others. His story is a beacon of hope. Now fact, frequently asked question. Number 1. Can soda really cause addiction? Yes, high sugar content can create a dopamine cycle in the brain, similar to drug addiction, especially when consumed daily. Question number 2. How much alcohol is too much? More than 1 drink per day for women and 2 for men is considered excessive by health organizations. Number 3. What are early signs of addiction? Craving, secrecy, mood swings, increasing doses, and withdrawal symptoms are common signs. Question number 4. Can water intoxication really kill someone? Yes. In extreme cases, it can cause brain swelling and death due to electrolyte imbalance. Number 5. What is the best first step to quit alcohol or drug use? Talk to a doctor or counselor. Joining a support group is often the most effective starting point. Now in conclusion, your health, your power. Intoxication does not have to define your life, whether it is alcohol, sugar, medications, or even water. Understanding the risk and making mindful choices can change everything. You deserve a life full of clarity, health, and meaningful relationship. Recovery begins with awareness and action. So if you or someone you love is struggling, don't wait, reach out, get help, and take back control. You are stronger than any substance.